Good morning. We start our working day at Ukraine Crisis Media Center. Now we are going to speak about palliative assistance, and this is the presentation of a campaign Знімай рожеві окуляри, take off your rose glasses. We have our guests, Kseniia Shapoval, Andrii, Rohanskyi, Director of Andrii Institute for Research and Strategies, and International Renaissance Foundation representative. Welcome on stage. Good afternoon, dear colleagues. Thank you for joining us today. We would like to announce the start of information campaign that is called Take Off Your Rose Glasses, why we raised this topic. For the last 5 years, together with our colleagues and from different organizations, we try to protect the rights of people who are ill. And the main problem is the access to painkillers, and we have all legal instruments to provide patients with painkillers, and we said about it in this press hall and during other meetings. But during 2016 we carried out a research, and my colleagues will tell you more about it today. It shows that patients face a lot of problems connected with the rights to get painkillers. I would like to outline the overall situation and to present some figures. First, palliative treatment is needed by more than 500,000 patients. 17,000 children need care, and also we are speaking about availability of morphines and the absence of morphines for children. And in Oblast there are different level of support, and it depends not on the Ministry of Healthcare, it depends mostly on the Department of Oblast and regional levels and on doctors. Why it is called rose glasses? When we address that some patient needs painkillers, and we address to the department, and they say that everything is okay and there is no such a problem in Oblast. And we would like to call on them to take off their rose glasses, and they should see the problem. And according to the data we have today, we would like to share it. In Dnipro city, according to our survey, there are 11 centers, and only one of them provides the patient with adequate painkillers. So we established some criteria. So doctors do not know what is this protocol, how to assess the level, and they should provide the patients, oncology patients, they can get access to painkillers with the help of local budget. And the doctors, they use right schemes, right protocols, and they provide this treatment to the patient, and they provide it according to requirements. And in Cherkasy Oblast, this is the case of one of our colleagues. He is not an oncology patient, but he has chronic pains, and he needs this painkillers, and he used all the legal mechanisms. He addressed international organizations and human rights ombudsman in order to get this palliative treatment. And for a large group of patients that are not oncology patients, it is difficult to get these medicines. Also, we have a case in the Rivnensky Oblast that the organization provides help to family. The patient died, but lawyers want to file the case against healthcare institution because she was refused of painkillers, and she was an oncology patient, and she died in great suffering, screaming of pain. And one of the situation observed by our colleagues, and Lesya Petrivna will tell us more about it later, we get to conclusion that in Kiev the situation is really bad with the provision of painkillers to patients. And the doctors here, they use all practices, old norms of legislation. We see the situation starting 2013. These painkillers can be given individually, and it can be done by a doctor, and previously only group of doctors would be able to appoint it. Now this commission is cancelled, and there is no need to create it anew. So we observe the situation in Kiev. They do not prescribe the injection form of morphines. Some doctors, they believe, and that this is the myth, that they can provide the patient only with this in tablets, and they do not want to provide injections. They believe that it needs more control, but there is no such legislation and there is no such limitation. And in Kiev we face the situation when the patients who have the right to get this painkillers, they are not able to get them, and the members of the family are forced to buy this medicine at their own expense. And for example, a family has an ill person, and for a long time they were fighting cancer, and we understand that this is huge money, and at the last stage of the disease it is clear that one dose of painkiller influences on the budget of the family. And we may say that about the costs and money that is in the region, and the cost of painkillers, it is different in different oblasts, and it is weird because we believe that there should be some policy to regulate prices for these important drugs, and this is an issue for further work. And in our information campaign, we are going to carry out some events. First in Sumy on Wednesday, we want to call on Oblast Department of Healthcare and the doctors of Oblast to take off their rose glasses and to provide adequate access. And also we plan to have a presentation in Rivne. We will inform about our campaign, and we ask everyone to join. If you have some complaints from the patients, we are ready to see them and to transfer them to the departments, and also to provide legal support to patients.
Why we have called this rose glasses? Just imagine you enter any healthcare institution and ask the chief doctor whether their patients are fully provided with the painkillers, and in this case you most probably would hear the answer yes, of course, and thus there is the picture made that that people are not suffering, that people do not suffer, that they are fully provided with painkillers with palliative aid, and this is a very narrowed point of view. You may also ask patients in the cancer hospital and ask questions to those patients who regularly receive the pain killers. Those patients who have fourth stage of cancer, they are not registered in their local outpatient hospitals because the local outpatient hospital is unable to provide them with the necessary treatment, and these people have to struggle with their pains and survive themselves. These civil society organizations carried out monitoring of the situation with access to painkillers in late 2016, and this monitoring was carried out among patients who received painkillers at home. It was not a sociological survey or pull out, but it was nevertheless rather representative sample, and this survey had demonstrated that the following things. The objective of palliative aid is to remove pains, and even the patients with the fourth stage of cancer could be could get full removal of their pains, while in our country the majority of patients recognized that they that their pains do not is not killed for 24 hours. They still feel some degree of pain during some hours of the day. Fortunately, now we do not have such situations when doctors do not appoint or prescribe any painkillers at all. Fortunately, we have registered only one or two such cases, but the medicines had to be prescribed in line with medical protocols existent in Ukraine, while sometimes they are prescribed by doctors voluntary, with not following the prescriptions. For example, in case of diabetes, a patient has to take insulin medicines regularly. Then people with hyper blood pressures should regularly take medicines regularly. And the instruction, the protocol prescribes small doses periodically, several times a day. in case the doctor prescribes large dose once a day, then this is not beneficial for the patient. That's why the doctors should follow strictly the protocols and prescribe medicines fully in line with these protocols. What is the reason? The doctors try to insure themselves against all possible cases. Of course, each doctor, of course, can read the instruction, while the instruction to the medicine contains all standard prescriptions. Just assume that we have an oncology patient with 36 years old, and she is on the fourth stage of cancer. She suffers of great pains, and the doctors do not prescribe painkillers until 3 days before death. This is their exact words, and this woman has to suffer on the one hand from daily pains, on the other hand nobody knows when there will be 3 days before her death to prescribe necessary painkillers. So our idea is to push the doctors to turn their faces to the patients. The doctors themselves say that we are not interested in treatment of old patients or those who are deadly ill. Of course, after reform of the medical system, when there will be special contracts for treatment of such patients, of course, that will become more beneficial for the doctors. So the objective of our campaign is to remind the regions and the bureaucrats in the regions that the problem does exist and that it should be resolved. Good morning, dear colleagues. I will start with the problem. In Ukraine, we have people with chronic pains. These are cancer patients and not cancer patients, and these people suffer because doctors cannot kill this pain, and these pains should be diminished to zero level. And why do the doctors reject from correct correct way of killing the pain? This because they fear. The statistics in Kyiv proves that 86% of managers, healthcare managers at the first level of management, they use very old methodology in killing pains, and this prevents patients from proper treatment. Also, in the past, in line with old approach, the prescription of painkillers was criminalized and under strict control of law enforcement agencies, and that fear remained till today. And this fear results in the total rejection of today's doctors to work in line with international standards. Recently, some pieces of legislation, some regulations were passed which allowed doctors to resolve this problem. Now doctors are equipped with state-of-the-art knowledge. They are equipped with proper regulations, and now they have to comply with these new regulations. The Ministry of Healthcare also has to play its role. First, it should improve the regulations for doctors, and they try to do this. Currently, the civil society, jointly with the healthcare ministry, continuous discussion of the protocol for treatment of pains among treatment of chronic pains with the children. And we continue our joint work on the regulation of treatment of chronic pains among adults. And the second way how ministry can help, they should address all the all the complaints from patients about non-prescription of painkillers. Unfortunately, as a civic activist and as a professor in medical academy, upon my communication with regional doctors, I discovered that doctors in the regions, they are ready to work in line with new methodology and new ways of treatment, but local managers, local healthcare managers in their medical institutions would not allow them to work in line with the new international standards, because those managers, they have all the authority in the healthcare institutions. They have that fear which I mentioned before. That's why we started this new campaign, Take Off Your Rose Glasses, and try to force those managers in the regions, all those who are responsible for pain treatment, pain killing, they should become aware of the problem and become prepared to provide all this possible aid to people who either will be cured, will be successfully treated, or who finally will die, but they should be relieved from their pains. We should fight for our rights. Maybe someday, some happy day, we would enjoy our rights without any pressure on the authorities and bureaucrats. The Ministry of Health is keen to bring painkillers and medical services as close to the patients as possible, and the reform of healthcare system is aiming allocation of funds to per one patient, not per one hospital bed, and the wages of doctors and all the benefits will become dependent on the real treatment of patients. So we encourage you to support these patients and their relatives and families, while we also encourage the bureaucrats and those from whom depend the relief treatment to provide, to pay attention at the problem and to stick with the new protocols. Thank you very much. I would like to say 2 weeks ago, my friend's mother died. During last 6 months, she had to receive painkillers, and there was a huge problem for rather long time for the family. You mentioned presentations in Sumy and Rivne. When and where in Sumy, this will be on April 19th. This will be in the regional department of health. This will be Raincars Hotel in Rivne, in Sumy, and in Rivne this will be on April 20th. This will be organized jointly with the local healthcare departments. Whether there will be any advertisements, advertising materials, handouts, leaflets, I don't know. On the framework of our campaign, we prepared video teasers, video materials. We have developed informational posters. Currently, they are under final coordination with the Ministry of Health, and we will disseminate them among the regions. We will disseminate these posters in the regions among those patients who require palliative aid. This will be posters with full information, who are liable to such assistance, whom to address, what doctor to address, and how to get these medicines. Also, we will organize press lunches in order to engage as many journalists to our work and to foster media campaign. I think this is the second experience of mass media campaigns. The previous campaign was in late 2011, early 2012. We have gathered information about those hospices where patients can get treatment. Now we have information about pharmaceutical companies and points which are able to deliver painkillers, and we had gathered information about civic lawyers who can and civic activists who are human rights activists who are involved in this work, who can provide advice and assistance, legal aid to such patients and families of such patients. So the next question: in case a doctor rejects to prescribe painkillers, whom to address? What should be the way, if there is a you face the rejection or resistance in prescription, you may apply to Renaissance Foundation, to Saborni's Foundation, to my colleagues from this campaign. The rule is very simple. If your doctor rejects to prescribe a painkiller, you should immediately write down a complaint to the leader of this healthcare institution and simultaneously send this complaint to the regional Department of Health and to the main office of human rights in Ukraine, and we will try to provide assistance. Also, we recommend to send a copy of such complaint to the Ministry of Health for control. But usually, as the experience proves, that such a complaint sent to the local doctor-in-chief, it brings a positive result at the first stage, not going to the ministry. I would like to add, on April 25th, in the Ministry of Health, they will have the Skype a conference between oncologists, children's oncologists, and other specialists dealing with painkillers, who will discuss current regulations about prescription of painkillers, and they will try to improve the situation. I would like to add, on April 25th, there will be regional presentation of the rose glasses in Cherkasy. Thank you very much. I wish you successful regional events and big coverage of regional doctors and less patients who needs painkillers.